Hi everyone, my name is Ian McLaughlin and I have a PhD in neuroscience. I studied the neurobiology underlying anxiety and addiction, trying to map out some of the specific neurons in the brain that cause people to experience, aversive emotional states and predispose, some of us at least, to developing substance use disorders and addiction. And just to start, I talked about this yesterday on a different platform, so if you caught this yesterday, apologies for any redundancy. Okay, so in the past, I've talked about the various efforts to develop whole brain-computer interfaces, generally focusing on Neuralink, a company founded by Elon Musk, that guy, and the primary device that the company's been working on developing, which you can see down there, and exploring the demonstration that they put out about a year ago at this point, involving a live pig exploring an environment providing the device providing a live readout of neuronal activity. And I will put links to the videos that I've done in the past in the description below if you want to check them out. And so what we're looking at today is progress towards developing more sophisticated brain-computer interfaces. And a fair question might be, what on earth is a brain-computer interface? So it's basically a mechanism that would enable the brain to directly interact with an external device of some sort, a computer, theoretically. And, a snarky person might, argue that we already directly interact with external devices. We use our fingers to do so, and that's true. But the point here is that, these kinds of devices would skip the need for any kind of physical interaction with, any device via the fingers, right? Any kind of physical interaction, right? That whole process is unnecessary, and it's unnecessary because this brain-computer interface enables the little neurons in your brain that would normally ultimately trigger, right, your fingers to move in specific patterns, on your smartphone or on your keyboard or whatever, to instead send those signals directly to a bit of technology that can send information directly to a computer of some sort. And so, one way it's been described is that these devices would increase the bandwidth of communication between the human brain and computer systems. And so, right now, we're reliant on our meat sticks, as Elon Musk calls them, to, interact with computers, right? We're limited by that. And so in some of the videos that I've linked below, I also talked about other companies in this space, the attempt to develop brain-computer interfaces and ultimately, potentially, whole brain-computer interfaces, meaning like the entire brain would be encompassed by the device. And, I mentioned quite a few of these companies, right, including one that's based in China that's received a pretty substantial investment recently. And they claim to have a device that rivals what Neuralink has put out there. And so the list of companies was fairly extensive and definitely not exhaustive, right? But one of the companies that I explored more than just, naming is called BrainGate, okay? And so this is one of their earlier iterations of their devices. And so BrainGate is an effort from a group spread across several institutions, including Brown, Stanford, and Case Western Universities, as well as Massachusetts General Hospital, and the Providence Veterans Affairs Medical Center. Okay. By the way, I applied to Case Western University and I didn't get in. Anyways, so it was initially established by a group at the Department of Neuroscience at Brown University, and they were working with a private company called Cyberkinetics Incorporated. Okay, and BrainGate, which is, again, the name of the company that we're going to talk about today, they evidently purchased this tech from Cyberkinetics. And so you can think of BrainGate as pretty much being a competitor to Neuralink. Okay, not exactly, right? They're not identical in their goals, but certainly like in the same space, right, of brain-computer interfaces. And so BrainGate has been around for, a while, certainly longer than Neuralink. And they've demonstrated progress since like 2002. Right, where they had implanted a microelectrode array in an actual human, right, rather than like an animal model of some sort. And so it's a sort of fun thing to acknowledge right from the start from their paper. And this is taken from their acknowledgement section of their paper for today, is that the Massachusetts General Hospital Translational Research Center, that entity has clinical research support agreements with both BrainGate, right, the company that we're going to talk about today, as well as Neuralink. So, it like doesn't really matter. That's not super meaningful. But it just really shows that, Mass General is like a fabulous biomedical institution. But, it's fun to notice that these various brain-computer interfaces these companies that are making these brain-computer interfaces are possibly using like literally the same exact operating rooms and like same clinical settings to conduct their different work, right? Okay, so let's get to the paper for today. So this is a paper, again, from a group across Brown and Stanford universities and Mass General, and they open up their article by focusing on the potential clinical applications of their device, right? Acknowledging that people who face, certain neurological diseases or injuries, things like ALS or strokes, or, obviously like spinal cord injuries, all of these things can result in paralysis. And so the goal of creating brain-computer interfaces is to restore these individuals' ability to communicate, right, with the outside world, and then potentially move again, regain locomotion. And so, there are several types of technologies that can be used to accomplish this, right? Some of which are basically technologies that you can pretty much like apply, directly to your head, right? These are things like electroencephalography or EEG, which is what this woman is wearing here, as well as technologies that have, greater access to what's going on underneath the skull, right? So there's no surgery involved with what's going on in EEG. They just sort of slap this EEG cap to your head. Usually they apply some kind of goo under the electrodes, but it's non-invasive. And so other strategies are things like electrocorticography or ECOG is like EEG. This is ECOG, or just intracortical microelectrodes, which you can see in this picture. This comparison. They're both, basically ways for computers to measure the activities of neurons just a bit more closely, right, and more precisely as a result, right, with ECOG sort of being like EEG that's applied underneath the skull, so requiring some surgery, whereas intracortical microelectrodes, like, actually penetrate into the brain itself, just a little bit. You can sort of see the little spikes penetrating into the cortex there. These aren't deep electrodes, but, you're just getting closer and closer to what neurons are actually doing, right? And so, as we're speaking, there are clinical studies going on exploring whether intracortical brain-computer interfaces, implanted in areas of the cortex that are associated with movement, the primary motor cortex or supplementary areas, whether implanting in those areas can help people regain movement and speech following some sort of neurological damage, again, a TBI, traumatic brain injury, or some kind of disease. And so here is a picture to give you a sense. Sorry. Here's a picture. More on that later. Here's a picture to give you a sense of like the neighborhood of the brain that's being targeted. Okay, so the motor cortex. And the motor cortex is pretty interesting in the way that it's organized in the brain. It's what's called topographic. In what that means is that specific groups of neurons in certain areas of the motor cortex correspond directly to specific muscles throughout the body, right? But as you can see, you can see sort of like the areas of the body, the muscles in the body, like where they land on the motor cortex. And you can see it's organized like it's pretty wacky, right? It's not like you can just like lay a human body, right, like a map, along the strip of the motor cortex, and you can see right where the motor cortex is. It's sort of like a strip along the cortex, right? That's almost right in the middle of the brain. It almost like dissects the brain, or I guess bisects the brain. But you can see that like areas of neurons that control things like the hand or fingers, it's like right next to where regions of the head or the face or the lips, and so on, like where the neurons that control those parts of the body are, right? So it's just sort of like an example of a system in the brain that isn't exactly organized the way you'd likely organize it if you were to like sit down and try and come up with a system to control our ability to move. And so, the idea is that those are the neurons that are associated with some of the like earliest events in the brain that ultimately result in the decision to move a finger or an arm or a leg or whatever, an eyebrow. And, so those neurons become active, and then there's this whole cascade of activity that ultimately arrives at the muscles that are, necessary for whatever movement is intended, right? The muscles in the fingers. And And so, if there's some kind of disease or some kind of damage that prevents that whole cascade of activity, arising from the motor cortex, sort of, and then making that activity making its way down to the muscles, if there's something that's preventing that from happening, it's sort of like putting a dam up in a river, okay, preventing water from flowing down the river. And so, what we can do with the brain-computer interface, theoretically, is you can just bypass that dam, right, by digging like a canal between the upstream areas of the river and your target area. So now water can flow despite the presence of the dam. You can make it so that the muscles ultimately receive the stimulation that they otherwise wouldn't have had, right, or wouldn't have received were it not for, the disrupted biology, neurobiology due to like the disease or the injury. Okay, and so, things that have been achieved so far include things like, enabling folks who are paralyzed to move their fingers, move fingers, hands or arms, reach and grasp things with robotic or prosthetic limbs, or even move their own paralyzed limbs, right? No prosthetics involved. And so other things have been achieved as well, right? One of which, I talked about back in the, Neuralink video, right? Where what's going on in this picture, this is somebody implanted with a BrainGate device. You can see what she is doing is controlling cursors on computers via like just currently existing brain-computer interface technology, right? This has been around now for a while. And so, you can see that this person is like literally plugged in, or, like Matrix style, right? Which, I think it's worth taking a minute to just recognize that like that's pretty awesome. And also that this group is trying to push the whole notion of brain-computer interfaces beyond what, was sort of speculated in that movie, in The Matrix, one of my favorite movies. And also the sci-fi stories that inspired it, right? Like Neuromancer, for example. And more on that in a second. But there are cables attached to everything, right? Which is understandable, right? There's a ton of data that are, involved in these interactions, right? And neural recordings between like the device, certainly the brain and the device and the computers that are recording that activity. It's a lot of data. And for many of the applications, that's not necessarily like a massive problem, right? But of course, it's not exactly ideal, right? To have to be wired in. And so that brings us to why I wanted to talk about this publication today. Okay, so this group, again, that spans, Brown University, Stanford University, Mass General, has demonstrated a wireless version of their BrainGate platform. So to date, wireless computer interfaces like the ones that I've been describing have never been demonstrated in humans. Okay, and so a while back in the demonstration that Neuralink put out, Neuralink, not BrainGate, they demonstrated the ability to record activities of neurons wirelessly in a pig. So hopefully I'm not blasting your eardrums again. But hopefully you can hear at least a little bit of the sounds, right? It sounds like somebody's maybe playing a keyboard or something. Those are the activities of neurons in this pig as the pig is sort of like, poking its snout around, right? The recording activities of neurons that are involved in, the neurons that become activated as the pig pokes around with its snout. Okay, and I went deep into that, or a little bit more deeply into that in some of the videos that I have linked below. But it was strictly recording, okay, what Neuralink had demonstrated, and that's what you were seeing there. And so yeah, if you want a deeper explanation, you can check out those videos below. But this group is basically Bigfooting Neuralink, right, by demonstrating that they're not only able to record the activities of neurons wirelessly, which is what Neuralink was capable of doing or demonstrating, but there's a functional back and forth between the activities in the brain of somebody implanted with a device and a computer. And so, excuse me, sorry. To be fair to Neuralink, Elon Musk sort of informally announced that they were working in non-human primates, okay, like a monkey of some sort. And they were interacting with the monkeys, according to Elon Musk, are interacting with computers in like a meaningful way. But this was not like a demonstration, right? This was literally just like a conversation he was having on Clubhouse, that social media platform, and so it wasn't like the sort of like Edison Tesla style demonstration. It was just a conversation. So we just take his word for it. I mean, I believe that they've accomplished this. I doubt he would say that they had they not, but we haven't seen that tech demonstrated. And also, it's worth acknowledging that none of what I've seen out of Neuralink has been peer-reviewed, okay? which in other words means that like none of their stuff has been scrutinized by other scientists and engineers, other experts in the field. And this recent publication, right, out of BrainGate has been peer-reviewed by other experts in the field. And, you know, that probably sounds like a pretty minimal distinction, like who cares about that? But it is a pretty big difference. It's a pretty big deal, right? That means that, like, you know, we're just sort of like observing what Neuralink is putting out there, but not really able to deeply scrutinize its validity or even if it's true. But although I certainly believe that you know what they demonstrated was the real deal, but this was scrutinized, right? BrainGate has been scrutinized. So what did BrainGate do? Okay, so they basically made a tiny little neurosensory like device, right? Brain computer interface that transmits activity from a 96 channel chronically implanted microelectrode array. Okay. And so the devices that they're exploring right now are battery powered, right? So they literally is powered by like a AA battery. At least it looks like a AA battery. But okay, that's cool. I mean, the cool thing is that it's wireless. But you know, having to replace a battery like on a device that's literally resting on top of your head, it's not awesome, right? But excitingly, they are currently exploring a version of their device that can be charged inductively. Right, sort of like how you know your smartphone can charge wirelessly. In my mind, that would be a fairly gigantic game changer for any device like this. Right, if you didn't have to replace batteries, if you could just like essentially hold a thing up to the side of your head or wherever, and just like let it sit there for a while, maybe like magnetic, it would just like slap on and then charge, and then you'd be good to go pretty quickly. Right, that would be huge. And so, but you know, anyways, and they're currently testing that, so we'll probably see that in the not too distant future. But they're already in non-human primates with this inductively charged version of their device. But the point of this paper was to describe the progress they'd made in making essentially the rest of the device wireless. And so that whole like chronically implanted microelectrode array, that's how they describe their device. It basically just means an implant with like quite a few microelectrodes, right? Those tiny little sort of spike-like electrodes that target the motor cortex, okay? So it's 192 of them, of those little electrodes to be specific. And so what's cool about this? So first of all, this system is able to deliver the signals arising from single neurons, okay? Not like whole groups of neurons, but single neurons, which, you know, keep in mind are like often quite a bit smaller than like the width of a human hair. Particularly in the parts of the brain that I studied, by the way, the medial lobulin and the interpeduncular nucleus, where those neurons are like ridiculously tiny, like frustratingly tiny. And so they're able to resolve single neurons to a computer system, record from them, send those data to a computer system, and do it all wirelessly. So that's pretty awesome. Okay, so they had 2 participants using their BrainGate system, and the goal was to enable them to point, click, and type on a computer. So basically like the ways that we interact with computers without any kind of brain-computer interface is using our fingers, right? But the main innovation here is the fact that this was wireless, and it proved to be just as effective as similar systems that involved participants being directly wired, right? Their earlier iterations of their devices. And so here's a quote from John Simmerl, who is an assistant professor of engineering at Brown, and he's also the study's lead author. So, quote, "We've demonstrated that this wireless system is functionally equivalent to the wired system that have been the gold standard in BCI performance for years." BCI means brain-computer interface. The signals are recorded and transmitted with appropriately similar fidelity, which means that we can use the same decoding algorithms we use with wired equipment. The only difference is that people no longer need to be physically tethered to our equipment, which opens up new possibilities in terms of how the system can be used. So that's the end of the quote. And I feel like when he says opens up new possibilities, that's like a pretty tremendous understatement. It's like almost humorously an understatement. But, you know, and most of you probably don't remember the days when, like, you'd have to use a wired telephone to talk to your friends, right? And texting, you know, wasn't even an option back in the day. We're pretty much talking about, like, the difference between being able to, you know, text or call anyone you want in the world from wherever you might be using, you know, a smartphone, right? And then having to purchase one of these ridiculous, you know, phone cords, you know, to be able to talk more than, like, 2 feet away from, you know, the phone, like we had to do back in the day. And so, you know, to be clear, like the innovations that BrainGate is publishing, it's not suggesting that you'd be able to like be in the middle of the Grand Canyon and interfacing with your computer systems like here, you know, back in Philadelphia, like across the country, right? But, you know, these are baby steps. And, you know, we had wireless home phones, right? Before we had widely available cell phones. So, that it's a similar kind of progress, and it's pretty exciting. So interestingly, the two participants who were implanted with their BrainGate system, they're pretty different in age. So one was 35 years old and the other was 63 years old, and both had spinal cord injuries specifically, okay? And were essentially paralyzed. And so there was also a fun aspect of this study that because the system was wireless, the researchers were able to collect data even while the participants were sleeping. And so that's the kind of thing that's like candy to a neuroscientist, right? And so here's a quote from one of the scientists on the BrainGate trial. So, quote, "With this system, we're able to look at brain activity at home over long periods in a way that was nearly impossible before. This will help us to design decoding algorithms that provide for the seamless, intuitive, reliable restoration of communication and mobility for people with paralysis." So that's pretty cool stuff, okay? Like legitimately exciting. And I think it's just worth taking a moment here to appreciate that this group is basically taking like what was pretty much proposed in the Matrix, right? Being able to like seamlessly interface with computer systems by like literally plugging in and pretty much making it even cooler, right? Like no need to sit on, the dentist chair in the Matrix and or in the real world, I guess technically, with like a giant guitar cable being shoved into the back of your brain. You just need a few antennae around your, in your room with their BrainGate system, and it can all be done wirelessly. And so, by the way, I say antennae, I should show you them. So you need to have this kind of thing right nearby if you have an implant, so that your computer, receives the data from your BrainGate system, wirelessly. So it's not like covert, right? That's a pretty big thing. But this is literally like the earliest possible iteration of this technology. Like again, think wireless landlines versus cellular phones. Another interesting aspect of this whole study was the ability of the team to adapt to the COVID-19 pandemic, like we all have had to, right? And so given the limitations on in-person interactions, they were able to train caregivers, right, who cared for these participants to sustain the wireless system, right? Making it so that scientists and the engineers themselves didn't, have to personally interact with the participants at all, or even directly interact with the device, right? And so this is, I imagine that this is an unintended, unanticipated, proof of principle that like people who have really no training in this kind of technology, were able to sustain this project. And it suggests that this technology isn't like prohibitively complicated or inaccessible, right? And obviously like caregivers, people who care for like some of the most vulnerable people in our society, they tend to be pretty highly trained and very competent, right? But dealing with like a wireless brain computer interface isn't exactly like one of the like standard components of their training. And so, all this to say that, BrainGate has officially surpassed Neuralink in terms of demonstrated progress, just judging from what we can see, right? What has been put out there publicly. And so, right now, today, there's a company that can directly connect the activity of neurons in your brain down to the single neuron scale to a computer system and do it all wirelessly. And so obviously, there's plenty of caveats here, particularly when it comes to the fact that like this technology won't be available to basically anyone for quite a while unless you end up participating in their upcoming clinical trials or at least studies. But I think it's safe to say that like this is now the new standard for progress in brain-computer interfaces. And so it'll be interesting to see what comes next, either from BrainGate or from Neuralink, right? Who I'm sure is now, they're starting to feel a little bit of pressure to compete. But then also, the other handful of companies that I named in my last discussion of brain-computer interfaces, like BrainCo, Emotive, Kernel, MindMaze, NeuroSky, NeuroPro, NeurAble, Paradromics, and on and on. There's like way more, and a lot of them have Neur right in the name, just like Neuralink. But so, there's a lot of companies working in this space. And it's also going to be interesting to see if the companies that are devoted to non-invasive brain-computer interfaces, meaning like, brain-computer interfaces that don't require surgery, again, like via EEG, if they're able to roll out, like a broadly effective device that enables people to meaningfully interact with a computer system, without having to do brain surgery, like literal brain surgery. And so last time I discussed a company out of Austria called Recovery X. It's recovery ending in an I and then the letter X. So I talked about them in the last video. And they're just like one example of a company working to improve the ability of like the human brain to directly interface with computer systems. And I'm also going to be interested to see what comes out of that Chinese company that, again, received a pretty substantial chunk of investment. And that company is called Neuramatrix, another Neura company. But it'll be interesting to see what comes out of that company. To attract that kind of investment, I have to imagine they've demonstrated some progress already. All right, so that's what I have for you. It's a sneak peek into your cyberpunk future, your Blade Runner future. And so if you dig this kind of thing, thumbs up if you liked it, and subs if you loved it. All right, thanks everybody. I will see you, I guess, around the same time, same place next week. See you guys.